been chasing a diagnosis for months or years, and every test keeps coming back normal, I want to tell you something that might be hard to hear. More testing might not be the answer, and I want to explain exactly why. Hey, I'm Becky. I'm a certified yoga therapist, and I work with midlife women who are dealing with pain, fatigue, and symptoms that their doctors can't quite explain. And one of the most common patterns I see is women who have done everything right, made the appointments, run the labs, seen the specialist, and they're still stuck. Today, I want to talk about what's often missing from that search. Not instead of medical care, because you might need it, but in addition to it. Here's the core issue. The medical model is built around a simple idea: symptom, cause, fix. And that model is incredible for acute illness, infections, structural injuries, think car accidents. You really want Western medicine for those. But chronic, shifting, whole body pain doesn't always play by those rules, because the body isn't a machine with one broken part. It's a living system. And at the center of that system is your nervous system, constantly talking to every other part of your body. When we only look for a single mechanical cause, we miss the system the pain is actually living inside. Here's what I see happen over and over. A woman does physical therapy, and it helps a little, but the tension comes right back. She tries anti-inflammatories or supplements, short-term relief, but it doesn't last. She gets more tests, and they're normal again. Or she just pushes through because that's what she's always done. None of those approaches are wrong. But if the nervous system is stuck in fight or flight, it will keep recreating the same tension, the same inflammation, the same pain signals, no matter how many times you address the surface level. Your nervous system affects muscle tone, inflammation, how pain is perceived, how your tissue repairs itself, even how well you sleep. When it's left out of the equation, you're treating downstream effects of an upstream cause. This is where somatic therapy comes in. It's not about stretching, and it's not about relaxation in the spa sense. It's about working directly with your nervous system through breath, through movement, through learning to feel sensation in your body without bracing against it, so your system can actually come out of survival mode. We work with breath patterns that send safety signals to the body. We work with somatic awareness, noticing sensation without the fear story attached. We work with gentle movement that releases what's been held instead of forcing it. And we build that capacity slowly, because a nervous system that's been on high alert for years needs time to learn a new baseline. I worked with a client, I'll call her Diana, who had 3 years of unexplained body pain. Rheumatologist, pain specialist, physical therapist, all normal results. She'd actually been told her pain was probably stress-related, and she found that both accurate and completely unhelpful, because no one told her what to do with it. We started with her breath, then with noticing sensation before the fear story kicked in. Over 6 weeks, her pain didn't disappear, but her relationship to it changed completely. Her body started to feel like something she was living with instead of something she was fighting. If you've been doing everything right and you're still stuck, I want you to hear this. It might not be that you need a different diagnosis. It might be that your body needs a different kind of attention, the kind that addresses the nervous system layer underneath all of it. That's exactly what we work on inside Rest and Reclaim Nervous System Reset, my 6-week program for women who are ready to go deeper than the next test. The wait list opens in August, and I'd love to have you on it. The link is right below this video. Thanks for being here. I'll see you in the next one.